Medicare Advantage or Medicare Supplement Plan? Which one actually saves you money over time? It's one of the biggest questions we get, and the answer might surprise you. In this video, I'm going to break down the real costs of both types of plans and walk through some common scenarios and show you which option tends to save people the most money in the long run. If you want help figuring out which plan is best for you, call the number below or book an appointment using the link in the description. We'd be happy to help you out free of charge. So let's start with the basics. Medicare Advantage plans, also known as Part C plans, usually have a $0 or low monthly premium. You'll get bundled benefits such as medical, drug, dental, vision, and you pay as you go with copays and coinsurances. A Medicare supplement plan, also known as Medigap, works with original Medicare and charges a higher monthly premium than the Advantage plans, but it's going to cover almost all of your costs, so you're going to have little to no out-of-pocket expenses, and you'll be able to go to any doctor in the country that takes Medicare. So it's low monthly premium plus pay as you use it, which is the Advantage plan, versus higher monthly premium and almost no out-of-pocket, which is the supplement plan. So the question is, which one actually costs less over time? So let's say you're comparing two options. Client A on a Medicare Advantage PPO plan, paying $0 a month. Now this client has a $20 copay for a primary care physician and a $45 copay for a specialist. In the hospital, this client pays $300 per day for the first 5 days, so that's $1,500. And her maximum out-of-pocket for the year is $5,900. So if they have a serious health year, say they go to the hospital once and they see a few specialists, they could easily spend over $2,000 out of pocket, even on a good PPO plan. Now let's look at client B on a Medicare Supplement Plan G. Premium is $170 per month, so that's $2,040 for the year. The only out of pocket is the Part B deductible, which is $257 in 2025. Now, even if they see 10 doctors and go to the hospital, they just pay that $257 annual deductible. That's it. No co-payments, no co-insurances, nothing else besides that deductible. So even though the supplement plan looks more expensive monthly in a year with high medical use, Plan G is going to save you money. If you're wondering which plan fits your health and budget better, call the number below. We'd be happy to help you compare your options based on your doctors, prescriptions, and financial goals. So who typically saves more with each plan type? So let's break it down by health situation. Let's say you're healthy and you don't go to the doctor much and you want a zero premium plan with extras like dental or gym benefits. The Medicare Advantage may save you more money up front. If you have ongoing health needs, see specialists, or just want peace of mind and no surprise bills, the Medigap plan is usually going to save you more money over time. Here's a client example. We recently had a client in Pennsylvania, was on a zero premium Advantage plan, but had 2 emergency room visits, specialist appointments, and a short hospital stay. Their total out-of-pocket for the year was almost $3,000. Now, because this client was still in their trial right, they were able to switch to a Medigap Plan G with no health questions, and their premium is only $175 a month, but their total annual cost dropped by $1,200 because they don't have to worry about any ongoing out-of-pockets other than the premium and the Part B deductible. Now here's where people often get tripped up. It's the networks and referrals on the Advantage plans. Going out of network can cost you a lot more and you may not be covered at all. Also on the Advantage plans, you have plan changes. The Advantage plans can change their network, their copays, and drug coverage every single year. And what might work now might not work for you next year, or might not be available at all next year. Even though the Medicare supplements cost more, they don't change benefit-wise or provider-wise. You can see any doctor anywhere in the country that takes original Medicare, no referrals needed. Your coverage stays consistent year after year. That predictability alone can be a huge cost saver in the long run, especially if your health does change. A lot of people choose Medicare Advantage at 65 thinking it's cheaper, and it is if you stay healthy. But later, if you want to switch to a supplement plan, you might find out you can't unless you're healthy enough to change. You may be denied acceptance into a supplement plan based on health. Now, there are a few situations like being guaranteed issue, special enrollment period, and living in a state like New York that doesn't have any health underwriting. But if none of those situations apply to you, you can be denied acceptance into a supplement plan. That's why it's critical to make the right choice early based on your long-term health outlook and financial comfort level. So to recap, which plan saves you more? The Advantage plan has lower monthly costs, but higher risk if your health changes. The Medicare Supplement plan has higher monthly premium, but lower out-of-pocket in the long term. So it all comes down to your health, your budget, and your peace of mind. Call us at the number below or book a free consultation using the link in description, and we can help you compare real costs side by side and find the right Medicare plan. If you found this video helpful, please like, subscribe, and drop a comment. We post Medicare tips every week. Thanks for watching, and we'll see you on the next one. Thank you.